This is the final lecture for exam 2, and in this lecture we're really going to look at the different utilization rates of dental services. Much like the epidemiology of certain oral diseases, there are also disparities between who utilizes and who needs the services within our society. So who actually utilizes dental services are not necessarily the people that are in really poor oral health shape. So we really need to increase public awareness in order to improve health and to create ultimately a larger patient pool if you're wanting to look at it from kind of an economic standpoint. So this is our lecture outline. In video 1, we're going to talk about essential terminology. This is terminology that you really need to get under your belt and understand. It pops up quite frequently on the boards, maybe not in a straightforward way, but you need to understand how dental, public health, and dentistry in general utilizes these terms so that you'll be able to kind of read the scenario and not make assumptions. We're also going to talk about some special considerations that impact utilization and the utilization trends in video 1. In video 2, we're going to talk about some factors that affect utilization of dental services, and then we're going to finish up by talking about some barriers that people face in terms of accessing dental services. But let's switch to that terminology that I was telling you about. The first term is need, and I know that you're probably thinking, Mr. D, I know what need is. And in dentistry and dental public health, it's not exactly used how we use it in common everyday scenarios. The way that we utilize this terminology in terms of dental services is much different than, oh my gosh, I need a break, or oh my gosh, I need that pair of shoes. The need, when we're talking about utilization of dental services, is a normative professional judgment as to the amount and kind of healthcare services that are required to attain or maintain oral health. So this is where the dentist or the dental hygienist is actually assessing the patient or the community population, and they're saying what they need in terms of how to get their oral health, their mouth, in optimal shape. So what do we need to do in terms of treatment or in terms of oral health promotion programs to be able to get that community or that patient into tip-top shape? This also includes the type of care that's available within that community. So you want to look at, going back to the second lecture, the dental infrastructure. Are there all private practices in town? Do they only take certain insurances? Do any of them take Medicaid? All of those types of questions impact the need of the community. Conversely, perceived need is all about the patient's perception. So what do they think the type of care that they need or the amount of care that they need to be able to achieve optimal oral health? And you can probably already guess that need and perceived need are not always the same. So a lot of times patients will have more of a superficial perceived need, but once we do all of our assessments, then we can actually educate and give our professional judgment as to what needs to happen for their oral health care. So for instance, a patient comes in and they want dentures, and they want all their teeth extracted and they want dentures. But once you do your assessments, all you find is that maybe they need a few restorations, maybe they need a couple of root canals. So they don't have to go to the extreme of getting all extractions and getting dentures. So that's kind of a difference between perceived need versus need. The third term is potential demand, and you can think of this in terms of a want. So the patient has a desire to receive dental care to address the need. So they've been educated in terms of what needs to happen in terms of getting their mouth in optimal oral care, and that has created potential demand. However, potential demand, that desire to receive dental care, doesn't always come to fruition, and we'll talk about that here in a second. And then our final term is utilization, and you can think of this as demand. And this is where the patient is actually seeking dental services. And when you're looking at the literature and the research, a lot of times it is reported in one of two ways. So it's either measured by the percent of the population that has gone to the dentist within the past year, or it is presented as the average number of visits per person per year. Typically, we're seeing the first one, the percentage of the population that has gone to the dentist within the past year. But do know that utilization, whenever somebody says that, you want to start thinking critically behind how they're defining the utilization. So let's apply this to a certain situation. So high school and college athletic teams, we know that the professional recommendations say that mouth guards, preferably custom made mouth guards, should be used during sporting events, especially contact sports, like basketball or field hockey or soccer, those type of things. So that is the need. That's the professional recommendation. However, a lot of young athletes across the country, across the university system, across the high school athletic system, they don't wear the mouth guards. So that is the demand. The demand is not there for the consumers. They're not utilizing them. So they have really low perceived need as to why they should be wearing mouth guards. And the potential demand, quite honestly, is pretty low in this aspect too, because they're not really desiring to go and get a custom fitted mouth guard because they don't have that perceived need. So how do we convert all of this into utilization? What we know is that once we add awareness to a patient's need or community setting, what they need, then we're creating potential demand or the desire to get there. So we have the need, that professionally defined aspect of what needs to occur to get somebody healthier. And then we're adding in awareness, that educational component. We're creating potential demand. If we have potential demand and we do not have any barriers for them to come into the dental office to receive care, we're creating utilization. So we have the desire to get care and we have the ability to obtain care there. However, we know that there are lots and lots and lots of barriers to utilization, and we're going to discuss that next. But some of those can include a lack of being able to afford dental services or even transportation, or having a dental office that is open when you're available to come to the dental office. Some special considerations of utilization. One thing is dental advertising, and we talked about this a little bit during oral health education, where the advertising, if you look at magazines or if you look at commercials, the advertising really kind of targets very superficial concerns, like fresh breath or whiter teeth. Therefore, the public information is very limited about certain oral diseases, such as periodontal disease. And sometimes the patient's really reluctant to question the dentist or their doctor. So they really, yeah, the dentist or the dental hygienist really needs to consider that that patient may not be aware of these other types of non superficial oral concerns. So we really need to take our time to educate there, because sometimes the patient is they revere the dentist or the doctor, and they don't want to take up their time to ask a lot of questions. So they just kind of take whatever the dentist and the dental hygienist says, and they might not fully comprehend it. Another special consideration is the economy. So dental care is very influenced by the economic conditions within the nation. A lot of people have the perception that you can do without dental care, whereas you can't really do without medical care. So they really see that their dental care can be put on the back burner, they can be put on hold um, until they get into a better financial shape overall. So we do see, whenever we're looking at economic recessions and whatnot, we do see dental services overall decreases when we have periods of economic recession. When the economy improves, the dental services tend to increase rapidly after that. We have a complicated market as well. And what I mean by that is that not only do we have the dentist and the patient in that relationship, but we also have a third party vendor that is also in that relationship, the insurance company. And all of these people are potentially identifying different needs. So we have the patient identifying the perceived needs. We have the dentist or the dental hygienist defining their need. And then we have the insurance company out there. And the insurance company, some of their employees don't necessarily always have a very strong dental background. So it's frustrating to me personally that insurance will dictate what kind of treatment a patient can get when they're not the one that is assessing their condition, and they're not really kind of looking at the patient as a person. So, the insurance kind of messes it all up and tells us what is permissible in terms of how to proceed with treatment. And then finally, we have discretionary income. So, dental care really competes with other things, especially in people that are in the younger age group. It competes with car payments. It competes with paying your student loans or paying tuition. It competes with the house payment. So all of that is, when you have very little discretionary income, dental care is going to also take a back burner to some of these other more pressing needs for that particular patient or person. And I don't want to give you the impression that I hate insurance. It's very complicated. I think that it does great things in terms of reducing the cost of health and dental care. But there are some frustrating aspects, of course, to insurance. So, in terms of utilization, like I said before, the variations in estimates, they very much differ from different survey approaches or different research methods. So you really want to be critical and look at that with a critical lens in terms of how they are defining utilization overall. What you'll see in the rest of this lecture in video 2 is that I'm pulling data from the CDC, which is highlighting the BRFSS data, and they collect data every 2 years on oral health specifically. So they actually have a category of utilization of dental care, and you can see over the years the trends of utilization of dental care. In the 1950s, it was very, very low. Less than 50% of the population was going to the dentist on a regular basis, or even going within the past year. So it was actually 37%, as you can see here. We start increasing, and we're seeing rates in the late 80s, early 90s kind of hit around 60 to mid 60s. And then in the early 2000s, we actually hit, close to 70% of utilization rate. So people were going actually to the dentist. 70% of the population was going to the dentist within the past year in 2010. Now, I do want to say that just because they went to the dentist doesn't mean that they're necessarily coming in for a prophy. It could include prophies, it could include preventive services, but it could also just be an emergency visit. So basically, what the BRFSS is saying with the percent of people with a visit in the past year is that they've had some contact with the dental office. And then you can see in 2012, we start declining a little bit as a nation. So we hit 70%, 71% in 2008 and 2010, and then we start dipping back into the mid 60s and ever since. And that is partially due to the economic recession, the mild economic recession that we experienced in late 2009, 2010, and so on. You can also see that Kentucky followed suit. We've always been less than the nation as a whole. And so we've been mid 60s since 2008. And then in 2012, we also took a dip there and hit like a 60% utilization rate there. So for testing purposes, I want you to know the trend of the percentage of visits within the past year, and I want you to know the 2016 numbers for both Kentucky and the nation. So that is video 1. In video 2, we're going to talk about some factors affecting utilization and some barriers.